Hello again, valued viewer. Trust you are keeping well because we are. How they say about a child who is in the toy store or something like that. The excitement I'm feeling right now is much more than that of that child. But I'm mature, so I get to, cloak it in. I get to just calm down. But inside, I am jumping, because it's another super exciting installment of the bookshelf beaming to you live from the studios of Western Spring Television. My name is Damilola Raphael, honored to be your teaching and learning advocate. I am confident, and we keep emphasizing this for the sake of those who may not. We know that there will be that 10-20%, who have not started working with it. And of course, there is the extra 20-30% who are just connecting with us for the first time, wondering, okay, so what's the mandate? Okay, so what's the push? We have a mandate for this season of the bookshelf that we are on, and we've been doing this for quite some time. We have quite some time more, so you are not late, okay? But they say it's better late than never. In this place, you are not late. You are welcome. The mandate for this season, the charge for this season that we're in is to prioritize and remember for those who have not caught up, and for those who are just getting to know, be informed that prioritize is a play on words. So we're talking about priorities, taking the first things first, what is most important, what you should do first, that's for priority. And then of course the eye part of it, the care of your eyes, very, very important. So please prioritize. You get to the office, don't allow yourself to get distracted with the latest gossip, office gist, social media, especially if there is a kitchen. For those of us who get served, I said those of us, for those of us who get served lunch at work, so don't go and turn the kitchen person to your paddy and then you forget the purpose for which you're there. And as students as well, don't turn the cafeteria to your headquarters. So please, let's prioritize. Most important things first, and of course the care of our eyes. That said, we're digging straight into the focus for today, and that's talking about types of libraries. And today we have talked about the legal library, academic library, a public library, quite a number of libraries. So today we are going to be looking at the medical library. This is something we have been, okay, it's gonna come, it's let's put it on hold, and now it is here, and I'm so excited. So now you understand when I said that I'm if not as excited, if not more excited, I am as excited as that child in a toy shop. We are going to be discussing medical libraries for today, and it's just one conversation leading to the other, and it's like, okay, so promise made, promise kept, it's gonna come. But before I introduce the guests to us today, let's give an overview really of what a health or a medical library is. A health or medical library is designed to assist physicians, that's doctors, health professionals, students, patients, consumers, medical researchers, and information specialists in finding health and scientific information to improve, update, assess, or evaluate healthcare. Medical libraries are typically found in hospitals, medical schools, private industry, and in medical or health associations. Okay, now let's move on now. And now it could also be an e-library. Okay, so it could also be an e-library. Let's talk about medical librarians now, because I have one of them right here with us in the studio. Medical librarians are skilled professionals who assist with resources and research in the medical professions. The focus of the medical librarian is to emphasize the use of evidence-based research and practice. This can be for both medical research or medical practice, as well as the medical librarian is expected the medical librarian is expected to be a resource for assisting with publishing and presentation of research. Medical librarians use web-based resources to conduct research and help generate evidence-based approaches to healthcare. Okay, now please do well to go through. I don't want for us to start repeating some of the things we have discussed before, so that we can make judicious use of the time we have on our hands. please go through the previous editions of the bookshelf. We have talked about the history of medical library. I don't want to go into details. If I do mention, fine, some things from there, but I don't want to go into details because we have a whole show for that, the history of the medical library. We have with us in the studio, very, very honored indeed, the head of the Medical Library UNIOSUN Teaching Hospital. He is also the director of Oshogbo Window on America, Mr. Olukayode Ibitoye. Thank you for joining us in the studios today. Good afternoon, sir.
Thank you, Damilola. Good afternoon.
Wow, I'm so excited. No, just look at his table and look at my own table. You will know I'm a learner. How are you?
I'm all right.
Thank you for joining us today. Eventually, you're here.
No.
Thank you. Thank you so much, sir. So tell us, the medical library. So many questions are coming to people's minds. Are you a doctor and then you decided to focus, just like you have specialties, you have gynecology, you have pediatrics, you have geriatrics. Did you just decide, okay, so I want to focus on the library part of the medical line? Are you a medical doctor?
Thank you so much, Damilola. It's an honor to be here. Thank you for inviting me. My name once again is Ibitoye Samuel Olukayode. I am not a doctor. I am a librarian, trained librarian. By way of fortune, I've, get myself where I am. It's not compulsory that you have to be a librarian before you can impart life positively. So where I am also fulfilled, and we are working hand in hand, and to make sure that we, arrive at a point. And what is that point? To fulfill the objective of the parent body, which is the patient, student, and researchers, so to say.
Okay, so Mr. Ibitoye mentioned just now the patient, the student, and the researchers because he functions in a teaching hospital. So we have, quite the number of the different rungs, categories of people right there. And he said you don't have to be a medical doctor before, you can really impact lives. So what was it like for you? Have you worked in any other kind of library outside of a medical library, or have you always been in a medical library?
Yeah, just like you have said, medical library is just an organ out of so many type of libraries.
Yes, sir.
So I've worked with a public library before. So this will be the second, place I am working as a, medical librarian. Do
you require, or does it require you to have particular specialization skills or trainings for you to function in this place?
Yes, of course, because though you have to have the general knowledge. Once you have the general knowledge, then you'll be able to flow. But at the same time, in a specialized library,
yes, sir,
that I find myself, I engage in, updated, training from time to time to meet up with the, information needs of the client, the medical library client or clientele.
Okay, so you said there are patients, there are students, there are researchers who come in to use the library. What has the experience been like? How are you able to, attend to these different persons? Do they come in and say, oh, this is my ID card, I'm a student, or this is my patient card, I'm a patient, so know how you treat me in this library?
we accommodate different type of users.
Okay.
We have the consultants, we have the nurses, we have the scientists, we have the pharmacists, we have the students of various kind. And because of the knowledge that we have been acquired, that, give us the knowledge on how to, address and how to cope with each of the categories I've just mentioned to you. So because of the knowledge, training and retraining, some other things like that, the experience and the relationship that, we have been able to form together, make us to able to cope and meet up with all the challenges.
Now, let me say this to you, dear viewer. I would that, we had this interview at the, medical library at UNIOSUN Teaching Hospital. At least I am speaking right now about UNIOSUN Teaching Hospital. The place is so cozy, so quiet. You wonder that you are in a hospital setting. So let me ask you, I know that the nature of my job requires that I put my nose in everything. But outside of being a journalist who wants to, know about this thing and then bring the information to the viewer, somebody is watching now and wondering, can I go there to check? Can I use it? I'm not a medical researcher. I'm just somebody who is curious. Who are the outside of these other people? Can others, in this category come in as well? Well, use the library.
With the introduction of Osogbo window on America, that give free access to various categories of users, you are qualified. But that of the medical library, we have our procedure. You must, it's either you are a student of various categories. We have the doctors who are still students. We have categories of them like that. When they come to the library, they have to, in a way of, the security aspect of it. Okay. You have to show your ID card that will admit you to go in. Even the staff, even the consultant, even when the head of the number one citizen comes, you have to identify him.
When you say number one citizen, you're talking about the governor or the CMD?
The chief medical director.
He also needs a pass.
Yes, now we can only because of the fact that he is our number one person.
Yes, sir.
We can capitalize on that and say,
to permit him
to jump the protocol and say, Oga, please come in. But apart from that, you have to have your ID card that will identify that you are either a doctor or student or whichever to enter and make use of the library. That is how it is applicable to all form of libraries, from head down to the last level.
This is getting interesting. So we're going to take a very, very quick breather. I spoke with Mr. Ibitoye, and I told him we're going to be talking about repurposing a library. Now, if you have been really following this program and you're watching the screen, you would have seen the titles attached to his name, the positions that he occupies. So we'll take this very quick breather. We'll come back on the other side of it, and we'll be talking about repurposing a library. What are the limitations, and how far can we stretch the use or the usability of a library? Stay with us. Thank you very sincerely for keeping faith with us right here on Western Spring Television. The bookshelf continues on the second leg of it right now, the second half of the bookshelf. And today we are looking at special libraries, focus on medical libraries. And of course, we have with us the head of medical library, UNIOSUN Teaching Hospital, here with us. He is also the director of the Osogbo Window on America, Mr. Olukayode Ibitoye. Thank you very much indeed. So let's talk about repurposing the library. So it's supposed to be a medical library. Then we have Osogbo Window on America. Where is the window? What are you viewing?
Well, thank you so much. Osogbo Window on America. The name confuses a lot at times. The window can be an information hub. A library on its own, information gateway, a space. Library by its a definition is a collection of books and non-books materials kept and organized by a trained librarian for reading and consultations. So it can be a space, it can be a hub. So the introduction of Osogbo Window on America, which is a blessing in disguise. If you not want to repurpose it, it's a blessing, which I said, if you want to repopulate it to a window on America,
yes, sir,
and transforming it, from a traditional health information center into a multifunctional learning, innovation, and community engagement hub, while still retaining its core medical information.
Okay.
It's a blessing, just like I said, traditionally, the medical library only, acquire books purely on medical, on medicine and some other related something like that. Subjects. And we go on, we have databases and so many other things. But this one is a transformation whereby you have, a digital, involvement, whereby you have a series of innovation. You have collaboration between the US and the UNIOSUN state government or Nigeria as a whole. Doing that, we are collaborating and we are advancing our course to another, technological innovations. And that, on its own, the window stock a lot of resources that ordinarily the medical library wouldn't have stored. Such materials are different databases, intranet, that will, help you or graduate you to the global world. And you can access more than the, limited resources that we have been keeping. That's why I say it's a blessing. So it exposes the users to so many, fuller resources, beyond the medical library. It's just an organ. Medical library is just an organ. But introduction of UNIOSUN State, Osogbo Window on America, make it so bigger, make it more big coverage. That when you come to the Osogbo Window on America, you get all that are needed globally.
Amazing.
When you are talking in terms of coding, AI, and so many other entrepreneurship, and so many other things like that, which ordinarily medical library will not have, taken care of. So it is a blessing, and for now, we are coping with the two. So if you come to the Osogbo Window of America, what you wouldn't have gotten from the...
Okay, now that's talking about for the viewer, for instance, who want to come visit. You said they would need the student or the doctor's ID card. Now, without that, they can access the Osogbo Window on America.
Yes, without anything. Well, the only thing is that we must be able to, verify that you are somebody that cannot create or create any security breach. And we just allow you. You will not pay them. You enter.
You don't pay to use that resource.
You don't need to pay anything. And just like I said, multifunctional, information and resources. We have, a perfect internet, facilities that's 24/7.
Wow.
Then we have laptops of various, degrees. We have textbooks. We have other materials. We have human and material resources that can attend to the need of whoever that comes. That one is free. If you see anyone requesting money from you, just let me know, because the US make it free. So people that have been coming, they use the library free of charge.
Amazing.
With various, resources, starting from the intranet. On our intranet, we update it from time to time. The very accurate, latest information globally that you can get for your, thesis, dissertations, and so many other things. If you are a researcher, you can get so many things done.
A non-medical researcher.
A non-medical researchers.
Okay.
A non-registered, users.
What? Let me ask very quickly. So many questions coming up right now. What days do you open? I had 24 hours. I need to be sure. What days and times does that facility open?
Well, because of the security situations, we open 8 a.m. in the morning Right now, we close at 8 p.m. in the evening. So you can make use of the library from morning till around that time. Main library, which is the medical library.
Yes, sir.
You know, the main library house the Osogbo window on America.
Yes, sir.
And they operate side by side without any, issues.
Yes, sir.
And so you can decide to use the medical library or the Osogbo window on America. So just like I said, 24/7, the internet facilities is unlimited.
Amazing.
Can be used anytime. Even most of the time, those who are nearby can make use because it is unlimited.
Amazing.
If you don't password it, you can make use of it.
Access it.
You can access it.
Okay, data gen, how market? If you don't want to go to read, you are hearing now that you can access the internet, but I think it is passworded, so whatever that is, I don't know. But at least go there. Everywhere is boring. There is nowhere to visit, nothing to do in Osogbo. Are you joking? And we're bringing you this information now. Let me ask you, this is what they call the jackpot, season, and people are hearing window on America. If I can open window, I can open door. So coming to use the library, visiting the library, using the library, does it open up channels for people to get visas, opportunities to travel abroad? Is that also available?
Yes, to some extent. Every Wednesday, we offer orientation to those who may want to go and study at the United States of America. We do orientation 5 steps in order to study at the United States of America.
Wow.
We make available series of information that can help them. Then during boot camp, we gather them, we expose them to 4,000 universities around the world, apart from even the one within United States of America. We expose them and we assist them. They can gain full scholarship for their studies. We have partial and at the same time full scholarship, but we make sure that we assist most of our students that come to that place with full scholarship. Many people have been able to
and this orientation is every Wednesday? Every
Wednesday.
What time is it?
It's between 10 a.m. to 1 p.m. live, and it's virtual, but those education advisors will be there taking the students. We have gotten more than 10 students from our end. But use that opportunity. We have a couple who, because of that, travel, who study social work.
Okay.
Is coming down to Osogbo window in America now to impart knowledge with what he has acquired from the United States of America. So every Wednesday, our doors
3 hours, 10 to 1.
Free.
And that is free as well.
But we don't deal with visa. We have we are under public affairs, section of the United States of America's consulate in Nigeria. We are a section dealing with that. Another section dealing with visas, but we work hand in hand.
All right.
Directly, we don't issue visa. We only help people towards achieving their aim academically outside the country.
To relocate outside the country. This is a beautiful one. But you know what really makes it appreciable to you is to visit the library yourself. Sincere appreciation to Mr. Olukayode Ibitoye. He's the head of medical library, UNIOSUN Teaching Hospital. He's also the director, Osogbo Window on America. We accompanying him just outside the studio here. We have Mrs. Oyewusi Abiola. She's the chief librarian in charge of acquisition unit. Also Mrs. Okunola Bosede accompanying him. She's the chief librarian in charge of circulation unit. Now, if you have been following the previous broadcast, you understand what those different units are into, especially that one where we have the academic library with Dr. Egunjobi. You should be able to get information on that one. This is where we get to call it a wraps, and I am not just going to be getting all my toys, more of my toys, because I've gotten some toys here. I'm also going to be getting candy. We'll see you next time on the bookshelf, doing it bigger and better. My name is Damilola Raphael, your teaching and learning advocate, saying goodbye and God bless.